So the two side effects from the medications seem to be nausea, vomiting in one hand. And again, that's because it slows the gastric emptying down, so the food sits in the tummy for a longer period of time. And the second thing that can happen with it is constipation. Patients don't poo as much as they... Now, those side effects can be very variable. Some patients start the medication and the side effects are small because we start patients on a really small dose. So for example, with Wegovy at the very beginning, we put you on 0.25 milligrams. And over the preceding 5 months, it gets doubled till eventually the maintenance dose is about 2.4 milligrams. So the side effects are greater with the higher doses, but not everyone finds the medications side effects affect them. Some people say, yeah, I get a wee bit constipated, but it's not too bad. Some patients come in and say, I've stopped the medication because I vomited non-stop and I can't use it ever again. So the side effects are variable with the medication. The other side effect, let's say, of the GLP agonist is pancreatitis. That's not so worrisome because if you have pancreatitis in the past, you cannot have the medications. Some patients complain that when they get the injections, they get a little reaction or a bit of redness in their arm with the injections. Some patients just won't take the injections at all. They just don't want to have the injections. But the side effects and the complications of the medications, they're pretty minor and small. It's usually not a huge issue for patients. The side effects of surgery with the gastric sleeve, some patients get a tiny little bit of reflux following a sleeve, and that's because the stomach's made smaller, so the intragastric pressure is a wee bit higher, and some of those patients can find acid comes up, particularly when they lie down flat at night. Maybe happens in 2 or 3% of those patients, but usually a medication called Solmac or Nexium will sort that out for those patients. The gastric bypass and the SADS does have two side effects if you're naughty and you make bad food choices. So if you went away and had a big plate of fried fish and chips or too much sugar in one go, those two operations can give you something called dumping and diarrhea. The excess calories of the fats won't get absorbed and come out of your poo when you go to the toilet. And dumping is when you have too much sugar in one go. So with the gastric bypass, the food passes through into your intestines a lot quicker than it would do if you didn't have a gastric bypass. And what happens with that is if you have too much sugar in one go, your body absorbs all that sugar, but it bypasses the pancreas, and that's how the gastric bypass helps diabetes. It takes the pressure off the pancreas. So all this sugar goes straight into your body, and your pancreas is taking it easy because there's no sugar bypassing the pancreas. And the person's sugar goes really high. So their sugar might go up to 12 or 15. Then the pancreas all of a sudden recognizes, oh, we've forgotten to produce insulin here to bring this sugar down. So the pancreas panics. It produces too much insulin in one go. And then the patient's sugar goes from very high to very low quickly. And they feel lightheaded, sweaty and nausea, and that's dumping. But that's only in patients that misbehave and don't do the right things. So the gastric bypass in particular convinces patients to eat healthily and eat in small amounts. The major complications from the surgery is the staple line. When we do the sleeve or the bypass or the SADS, we have to staple the stomach vein and the intestines, and those staple lines can not heal properly. The most common reasons for it not healing, the highest risk is in patients who smoke. Smoking damages the small blood vessels and makes the tissues not heal as well as they normally would do. And the other patients that are at high risk are patients who've had previous weight loss surgery. So previous weight loss surgery or other surgery on their stomach can damage the stomach and give them scar tissue on the stomach. And scar tissue doesn't heal as well as healthy tissue does. But the leakage rate, mainly because of the advancement in our instruments and techniques, are much, much smaller now than they used to be. So we have a registry in Australia called BSR, the Bariatric Surgery Registry, and every surgeon should put their data towards the BSR. And our complication rate in Australia overall is 1 in 1,000 leak rate, so the complication rate is pretty small, but that's mainly because of the tri-stapler where we fire 6 rows of staples, the use of seam guard, the Gore-Tex to reinforce the staple line, and the use of tissue, the glue over the top of the staple line to prevent bleeding. A fourth layer of reassurance that I use is in patients who've had previous surgery, particularly patients who've had surgery with another surgeon and hasn't gone as well as it should do and have some scar tissue in their stomach. The fourth reinforcement we use with that is to actually oversew the staple line. So we take a stitch and we actually oversew the staple line. So in patients who've had previous surgery, and we call revision surgery, there's actually 4 different mechanisms we use to try and prevent the leak. And I performed about 5,000 of those revision surgeries.